I want you now to comment a little bit about what you remember about those years, those bad years that kind of set the context for the amalgamation. Okay.
Well, I think some of the other pieces that contribute to the picture is the privatization that was occurring at the same time. So we saw the privatization of linen services. We saw the privatization of food services mixed with the massive cutbacks in all staff. So it wasn't just a quarter of the nursing and healthcare workforce. I mean, it was a large number lost to housekeeping, lab techs, technicians, dietitians. It was the entire picture that was cut back. And it's difficult sometimes to talk about because it wasn't a reflection on those people that were in the system. They were doing their job and they were working as hard as they could, but there wasn't enough of them. And so I noticed a drastic change in the cleanliness of hospitals. In addition, there was operating rooms that were shut down because of their reductions, and so waiting lists were starting to grow. This is when you first saw some of the longer lists in hip replacement and knee replacement orthopedic surgeries. Those things started to grow. It was hectic. It was busy. People were doing the best that they could, but there wasn't enough people in the system, and the patients were starting to see that. They were commenting on the cleanliness of hospitals and the areas where they were receiving patient care, quality of their food, the ability for, I guess what they envisioned as sort of the total patient care starting to be eroded. I know that I certainly, as a registered nurse, didn't give back rubs past the 1990s end of time. And then as we got into the mid-1990s, I didn't have time to sit down with the patient and say, who's going to be home with you? Is there anyone going to be cooking meals? Is there anyone going to be able to help you get your groceries? Is there anyone that's going to help you bathe and dress? Those things got pushed aside, and so patients had to, I guess they looked after them somehow on their own. As that piece is vacant from my memory. I remember not being able to do them, but I don't know what the outcome was for the patients. And I'm sure that they saw this erosion of healthcare, both on what they were witnessing as an inpatient and the cleanliness and the ability to get maybe a pain medication when they were, or even having a nurse answer the call bell in a timely fashion was dwindling away. And then we used to laugh about it at the time and say, once your eyes were opened after surgery, you were put down the chute into your car and away you went home. And how you managed at home was your problem. It was horrible. I mean, there wasn't a nurse I didn't talk to of our members that said that they were, it's just what I remember in my head, that they went home feeling totally unsatisfied. They hadn't completed their jobs, and many of them, and I remember myself when I was at the bedside going home in tears, feeling like, I only did what I could get to. I only did my priority stuff. I couldn't look after the total patient, and somehow, I mean, that wasn't coming close to doing what I was trained as a nurse and what I expected in my own ethics to be able to look after a patient in a total way.
What are two things that you can think that you specifically gained in the last little while after the merger? Because it's been 10 years. Or can you think of anything that you at least prevented them from taking away at the bargaining table because of your increased bargaining power?
I'm sure there are things that they're in there, Winston, but it's not something that's really jumping to the forefront right now. I might be just kind of, yeah.
Just go on and talk about other ways in which it might have been positive.
You
mentioned negotiations, you mentioned the big Bill 11.
Yeah, I think generally sort of the fights against privatization, some of the stuff that's gone on with regionalization. I think some of the disputes and the struggles we've had with labor boards, there's been a recent success in that labor, and certainly the Alberta Federation of Labor was a key leader in, but the CEP and United Nurses of Alberta were also key leaders in that, and having some changes, hopefully, undertaken in how the labor board makes decisions and how they are in collaboration with or not collaboration with government. I think those are successes. From a membership standpoint, maybe for the members that are close to the bedside, I hope and I think they see a more unified front. Not that there was great disunity when there was two nursing unions. I think we still had similar goals and similar purposes. And there's still the local structures in place that I think that the locals that were formerly SNAA still see their local executives as strong local executives, as leaders, both in their facilities and within United Nurses of Alberta. I like to think that SNAA helped initiate some of those leaders that are still around and to position them to be leaders within United Nurses of Alberta. I still see some of them that way. So I think the membership, for many of the members, it's an evolution now, and some of them have never known that there were two nursing unions. But those that did, I don't think, I've never heard that anyone come up to me and say, we never should have done that, or that even that it was done at the wrong time. I think there's a recognition from most people that that's where we were and that's what needed to be done. And after 10 years, we're all the better for it.